Normal life came to a halt when Nigeria recorded her first COVID-19 case on February 28, 2020. The novel coronavirus, which has plagued countries across the world at first, did not hold sway among many Nigerians due to the propaganda around the health crisis. But with the discovery of more cases and recorded death, many began to realize that Nigeria was in for a bumpy ride.
This particular coronavirus has a predilection for affecting the respiratory system of a human being, and if it does, its presence sparks a series of reactions within the body, which is manifested as a fever, as cough, and for some people it could progress to having difficulty in breathing, and if it's not managed, it could result in respiratory failure, and eventually, for some people, sadly, it could result in deaths.
On the 27th of February 2020, an Italian man who works in Nigeria came in from Milan to Lagos, and it was perhaps the first case that Nigeria recorded. And on the 28th of February, the Nigerian government announced that Nigeria has recorded the first case of COVID-19.
I don't think Nigerians took it seriously. I was actually one of them. We just thought, or would I say, I am among those that thought the pandemic was just a scam from the government to just get some United States money or just make money off Nigerians, which is what happens every day.
When I found out about the fact that there was COVID-19 in Nigeria, I was very not concerned. I wasn't bothered about the fact that there's COVID-19. To me, it was just like every other thing that comes and goes in the country. You know, I just knew that there was something called COVID-19, but to say I didn't really believe in it was the situation. I was feeling a bit of way. I was having high temperature. I was having high fever, and based on that, I said, let me just go to Gariki Hospital and then do the normal malaria and typhoid tests. On doing the test, the result came and I was told that I didn't have any malaria parasites. You know, so that got me a bit worried as to the fact that I don't think I've heard about in Nigeria where you go for a malaria test and there is no malaria parasite. I mean, there's always malaria parasite. So that got me a bit worried, and then I just decided to go for the test. And when I did the test, in between the test, when I did the test and when I got the result, I realized that I lost my sense of smell completely. I couldn't smell anymore, and I lost my sense of taste as well completely, you know. But then at the end of that week, my test was confirmed to me that I was positive, and that was when I realized that, oh really, so me having that high temperature, me having that fever, me losing my sense of smell, losing my sense of taste were probably symptoms. But just because I did not worry about the fact that COVID-19 was going to get to me, I was just not bothered about the fact that I knew it existed, but I was just in my subconscious was like it wasn't going to affect me.
Almost no nation has been spared as the pandemic has swept across the world, but responses to the disease has differed greatly from country to country. While quarantines, lockdowns, border closures, and restriction of religious and social gatherings have been enforced, there are still variances in the way countries are implementing measures and the general adaptation of the citizens.
Before the advent of COVID-19, Nigeria has just 3 molecular laboratories that is actually working. But now, since the advent of COVID-19, we now have close to 30, if not more than 30 as we speak, where you can actually, the test is taking place. Nigeria is doing more testing. Unlike when this virus came into existence, we had limited place to actually run the test, for people to actually know whether they have this virus or not. So I think in that area, there's been a tremendous effort.
Yeah, let's give the government a thumbs up, because right now the government is actually giving out lots and lots of palliatives to businesses that are willing to offer. And the best part about the palliatives the government is giving out, or the loans the government is giving out, is they are giving out the loans at 5% interest rate. So that is fantastic. 5% interest rate, meaning is even lower than, I think the lowest loans we have in Nigeria right now is either BOI or Development Bank of Nigeria, which is about 10% and 12% interest rate. But the government is giving out loans at 5% interest rate, which is way lower than BOI and Development Bank of Nigeria. So that goes a long way. You know, then I can actually do the business and get something out of it and still be able to pay you back the principal?
At first, when we had, the first 100 case, they were handling it, effectively. But then as we got data that the cases were escalating, at some point, I feel they didn't get a grip of handling the pandemic. There was a time the DG of NCDC tweeted and said, we urgently need testing kits. We are aware that Jack Ma donated a couple of kits, testing kits and PPE material, face mask. 2 countries, and Nigeria was also a beneficiary of this. So when he tweeted that, and we know that the president first approved 5 billion to be given to NCDC to respond, health-wise, 10 billion to Lagos State government.
Compared to the measures that developed countries have taken, the measures Nigerian government took was not in favor of Nigerians, because there was a lot of money that we feel was allocated for COVID-19. If you want people to take the measures serious, you should have made plans for them. In Nigeria, they were giving 1 Indomie, 1 can of rice, 6 cubes of Maggi to stay at home for the next 3 months. The government was not being fair to Nigerians.
Nigeria, the most populous country in Africa, has awakened to a new economic and social reality as a result of the global pandemic, with schools shut down, offices closed, and ultimately the plunging of our economy. As a result of the spike in unemployment and constant restrictions for business operators, some organizations are beginning to adapt to the new realities, and for the rest, it is time to brace up.
Before the COVID, where our revenues per month was in the 9 figures. But after the COVID, or during the COVID, because COVID hasn't ended yet, it has dropped down to like the 7 figures. Regardless, we have to put strategies in place, we have to put measures in place and all that, and we're trying as much as possible, working with the NCDC, trying as much as possible to make sure we put the requirements in place. For example, we have installed the full body disinfectant. We have sanitizers around the place. Our housekeepers go around and clean the environment at least like 10 times a day. We clean places, public areas that are frequently touched, like the reception, the public tables and things like that. We clean those almost every 30 minutes to disinfect it. Basically, what we did was we had to cut our staffing. We have a few staffs that are in-house. When I say in-house, I mean they stay in the hotel. About 10% of our staff stay in the hotel, while the other, about 90%, are back at home. But being back home doesn't mean we have completely forgotten about them. At the end of the month, as much as they are not working, we should give them stipends at the end of the month. So at the end of every month, even the people that are back at home, they receive stipends. As it might be little, some people might call it chicken change, but it goes a long way to someone that hasn't been working for a minute, someone that hasn't been working for a while, someone that's been at home for a while. So it goes a long way.
You sometimes have to look at it that this virus, we were at a war. This virus was like an enemy, and we are to face it. We can be soldiers, and all it takes, the weapon, it was an easy, rich weapon. It's human, be a human. And that's what we took. It's not time to make money, it's not time. Like, if you lose someone precious to yourself, what will you feel? And if we survived, what will we tell our kids? During the virus, we took advantage of it, or during the virus, we helped, we learned how to be humans. And that was the main thing that we did and we worked for. In Abuja, we have a lot of expatriates. So they are part of China and other countries. They are coming, they are also our customers. They also have to see this business knows what's going on. Like sanitizers, temperature, all those things. We had to even as part of our marketing, we are a safe place.
Before the lockdown, so when we had the first incident case, a week before government actually institutionalized lockdown, Connected Development locked down her office because we understood the virus and the crisis the virus is bringing. And so what we did in Connected Development have 35 full-time staff. We have about 12 volunteers at Code, and Follow the Money have 6,000 volunteers across Nigeria. So what we did was to first provide allowances for all our staffs and volunteers, allowances for alternative energy, because we know power is an issue in Nigeria. We provided allowances for internet access so that people can, because right now we use a lot of data, and working remotely you use a lot of data connecting to virtual meetings and also meeting your deliverables. And we also set up a channel, a dedicated channel, 24 hours dedicated channel where you can reach me or reach management, to provide psycho support for colleagues, because what we also saw is a trigger in depression.
TOS TV Network, in like manner, has in the last couple of months restructured the work schedule of staff members in line with the WHO guidelines and NCDC rules. While the Presidential Task Force and the NCDC are actively working closely to control the outbreak in a bid to gradually return the state of the nation to almost normalcy, COVID-19 has greatly exposed Nigeria's biggest weaknesses, which are corruption, a failed healthcare system, and economic fragility.
Corruption is something that has eaten to the fabric of every sector in Nigeria. But I think in this era of COVID-19, people realize that when you take a funds away from what is being used to fight a pandemic, that has ravaged the whole of the world now, you're actually doing yourself more harm. So people will be so conscious of the fact that, why do I need to do that? Looking at it holistically, Nigeria wasn't prepared because our economy at that time was, after the recession we had, we're gradually picking up. We're still, in the process of having a full-blown economy, a smooth economy to run. But when the pandemic came up again, you discover that Nigeria's economy went down again. That led to the change in price of petroleum and other commodities that you can see as we speak today. Fuel is now being sold at 123 naira as against the 145 naira. So you could see that even in the international market, the way Nigeria said is quite different from the way it was sold before the pandemic came into existence. So it has really affected the economy, and we are hoping that sooner or later the economy will pick up and Nigerians would have a benefit of what they are supposed to have at this time.
COVID-19 has just come and reset everything, not just showing us about our weaknesses and our gap. And what COVID-19 has also done is to say that as much as we want to grow economically, increase our non-oil revenue, our export revenue, health is wealth, ultimately.
Before now, we didn't have a governance structure for an outbreak response of the magnitude of COVID-19. All of that was only put in place when the disease came into Nigeria. And if you look at, again, in terms of health financing, in the past couple of years, our health expenditure has hovered around 5% of the annual budget, as against 15%, which is prescribed by United Nations. In terms of health workforce, we've, in the past couple of years, witnessed very high rates of brain drain, emigration of doctors and nurses out of the country. And this has left significant gaps in health care delivery in the country in general at all levels. And this, coupled with a health workforce that is grossly underpaid, meant that we had a health workforce that was, one, deficient in number and also deficient in morale to face a crisis of this magnitude. In terms of equipment, in terms of health infrastructure as a whole, before the onset of this pandemic, across the entire country, there were less than 500 beds for isolation, for managing cases that required isolation. And the bulk of these beds, we find them in major cities like Lagos and Abuja. So all of this points to a very poor level of institutional preparedness for a disease of this nature.
Although no one is immune to the coronavirus, survey has however shown that the less privileged of our society stand to lose more as they are equally fighting hunger, with many left unemployed. A survey conducted on the streets of Abuja, Nigeria's capital, gave us an insight as to how some citizens are adapting to the new normal.
It has affected my livelihood because there is restriction of movement. I cannot go down to Lagos to see my family or for them to come down here to see me. So we only communicate through telephone.
The presence of COVID-19 has not really made life so easy, in the sense that before this time, one will come out for work on a daily basis and there's something you take back home. But with the presence of COVID-19, a lot of restrictions here and there, people don't come out anymore, and this has grossly affected the work I'm into.
The order of doing things have changed totally in the whole world. You have to learn how not to shake hands. You have to learn how not to hug people. You have to learn to sanitize your hand at all times. And within this context, I think things did not remain normal as it were, because that has not been the real order of existence before now.
But notwithstanding, COVID-19 has not come without teaching us a lesson. It has come to make us understand that there is another side of life. Before this time, people run from one places to go to work, but we discovered that with this presence of COVID-19, one can take advantage of exploring other means of really raising income. That is transacting. You can be at your home, getting an order from somebody and making somebody to go and deliver that order, not necessarily involving you. That is the use of the social media.
I think fairly enough, I've been able to cope with COVID-19 pandemic era based on the fact that I create activities for myself, give myself time to read books, engage myself in other activities that will take my time, most especially that there is rule of engagement for the activities during this era, which includes social distancing. And you can't start going out when you know that there is no need for you to go out. Most importantly, offices and other avenues for businesses are closed. So I use my time by reading books and staying at home.
I do pray along with the government that God will open their eyes of understanding to see the solution to COVID-19, because it's affecting individuals, families, the society at large.
The new normal frightens us all, but change is constant. In order to thrive, we must continue to revisit all the measures put in place and re-evaluate their effectiveness as we progress.
We can never abdicate the role of government, to private individual or private institution. But I think that one critical place where we're getting it all wrong is the fact that government up to date is not inclusive. And what I'm saying in simple terms is give back government to women. I'm stressing this because if you look at, and let's look at data of how countries have fared during this crisis. The countries that are led by women that are doing very well, that they've even opened up their economy. But the countries that are led by men, people you call strong men, are doing badly. So why can't Nigeria lead Africa by taking our dear country and give women to lead us towards prosperity, because women are natural leaders. I cannot emphasize this enough. Let us give leadership to women in this country. And the face of leadership is not only men. Men have failed. Yes, we take responsibility. Even if our government don't want to, men have failed. Let's give this country back to women.
In every change, you have to be creative. That's life. If you see things going up, you try to find the way how you adapt with it. If it's going down, you have to find the ways to adapt with it. You can't just stand and say that I start to nag or start to blame the government or blame the people. You can't do that. You have to be creative. You have to find ways to make things active. Today, I heard on Saturday there's a concert. People will be in the cars. People want to live, so people have to be creative. And we are going to survive.
What we never took as important, now, if you don't have it, you won't even benefit much. Education. If we took education very important, and I'll focus this most especially to the North, if education was taken as an important tool, it would have helped us now.
Scientists have said it would take a minimum of 18 months to develop a coronavirus vaccine. Therefore, as a people, the responsibility falls on us to continue to learn more daily about the disease and employ preventative measures at all times. Although the new normal frightens us, we must accept and adjust to living with COVID-19.
Please always make sure when you go out, you have your face mask. Always have your face mask. And when you get into crowded places, try to exempt yourself. Keep like 6 feet or more. Or if you're closer to the person, try to keep 3 feet if you need to talk to the person. And don't forget your hand sanitizer. Make sure anywhere you enter, an office, a building, a shop, make sure if they don't even have their hand sanitizer, you try to caution them about it. And don't forget, each time you go out and you come back to the house, make sure you wash your hands. Forget you use the hand sanitizer. Still, washing your hands frequently will always help you.
The COVID experience generally, for me, wasn't terrible, right? And that might not be the case for everyone else. So that's why I tell people, individually, in your own way, just try and stay safe. You know, keep up with necessary health precautionary measures as they've advised, as little as washing your hands with soap and water, which I think is very, very effective, right? Sanitizers as well, where you don't have access to soap and water. You know, you use a face mask if you have to come in close proximity with people. And even if you don't have to come in close proximity with people, social distance, 3 meters, 4 meters, whatever meters, give them distance, right? This is not a time to be lovey-dovey and friendly with everybody. It's a trying time, and if people don't get it, I wonder how soon they get it. Maybe until they die, then they will understand. Because I see a lot of people walking on the streets, living casually, zero their mind to the fact that it's not going to come to me, I don't care. I was like that too.
TOS TV Network mobile app is now available. You can now catch up on our breaking news, stream our programs live, watch out for the latest update on sports and politics as they unfold. You can also get notifications for our upcoming programs and events. All these on our TOS TV Network mobile app, available on Apple Store and Google Play Store. TOS TV News from Africa by Africans.